Over the past few weeks, we spent a lot of time in this program discussing the situations when it comes to schools. And as you probably know, the president, he's pushing them to reopen all the way, right away, even threatening to withhold aid from districts that do not send their kids back into the classrooms. And we've spoken with parents, teachers, administrators, and more. They all say reopening too soon is too dangerous. A large new study from South Korea seems to back up the thinking of that contention. It shows that kids under 10 can spread COVID to others, but the risk is fairly low. However, those between the ages of 10 and 19 can spread it at least as well as adults. Now, that study comes out as parents everywhere are trying to figure out what to do once school starts. And if they read this piece in the same magazine, they could get even more concerned. It asks the questions, will college campuses be the next super spreaders like nursing homes and cruise ships were? Let's bring in our guest right now, Laura Meckler, she education reporter for the Washington Post. And Laura, let me start off with the college kids. And like a lot of parents out there, I'm conflicted. I've got a kid who's supposed to be a freshman in the next month, and while schools are wrestling as to which grades, which years go back and at what time and what component is online learning, there's dorms, there's fraternities, they are 18 to 20 something year olds, and by definition judgment not always at the top of the list. How concerned should parents be, not just for the kids, but also for the broader college community, the professors, the people who work at the schools, etc.? How's this going to work? I mean, some parents got to make up their minds here in the next couple of days.
Yeah, I mean, it's a difficult decision about what your level of risk is. I think it's a lot tougher call on the elementary and secondary education, K-12, than it is for colleges, because it is possible to learn online much more easily in a college environment. So you presumably you do have adults there, albeit young adults, who should know how to mitigate those risks. But we, of course, have seen that some don't follow the advice. They don't wear masks. They do congregate close to other people. So I think that if my children are much younger, but if I was a parent of a college age student, it would probably depend on what my assessment was of that kid and what his or her likelihood would be to, use good common sense.
And also, there are some elements where you're putting kids in a common dorm. They're traveling in broader places. There will be congregation. Even if you feel secure about maybe their health, the risk of spread, we've already seen that with some of the college teams that have gone back, how quickly it can spread in a locker room, and a dorm isn't that radically different. But let's get to that K through 12 population, because I opened up the phone lines last week, and with near unanimity, and I spoke to administrators, I spoke to parents, to teachers, they all thought too much too soon. To that end, it just seems that there's so many moving targets. I've heard some interesting ideas. Everybody agrees it'd be better if there was in-person learning. Maybe it's K through 5 that they open them up and the other kids online learn, or they have some form of a staggered schedule. But from your reporting, how concerned is it that every school district seemingly has to make up the rules on their own with very little in the way of common guidance?
Well, actually, there is guidance. I mean, there is guidance from the CDC about how to go about doing it, and includes a lot of very specific things. Now, it's been kind of poo-pooed by the White House, but that guidance is out there, and there are school districts looking to it. They also look to their local health departments. I mean, K-12 school, and higher ed for that matter, is a locally driven enterprise. It is, those decisions are going to be made at the local level. So I'm not sure that anybody really wants to change that. I mean, if the federal government starts making the call, I guess you would be happy if you liked the call, but not so much if you didn't. So,
but Laura, to be fair, you're absolutely right. But I guess my point is, there is the specter of a governor, or obviously the White House, pressuring, and now you have aid being threatened as well. These decisions aren't being made in vacuums right now, and there's all the attendant pressures, and somehow politics has gotten involved. I can only imagine what schools making up their minds. We saw the scene in Utah last week, the pressures they're getting from certain parental groups that are attached as well. It's not just simply following the CDC guidelines. There's so many other factors that are putting pressures from both sides of this.
For sure. There are tons of pressures. And let's also keep in mind that this is not an easy call. I mean, I think the way you're presenting it suggests to some extent that it's an easy call, just keep the schools closed. But in fact, there are severe downsides to keeping schools closed as well. I mean, and those are from an academic point of view. I mean, anybody who lived through remote learning in the spring knows that it was far below the quality of what we've come to expect from school. And also from a social emotional point of view, it's not good for kids to just be at home, fighting with their siblings, having their parents trying to get them to do their work, staring at a screen. And in fact, it also keeps a lot of parents who need to go to work and they can't, but they're home, because they have to watch their kids. So, I mean, there are a lot of factors. So it has gotten very political, but it is not an easy decision. I don't think. And that's why you see a lot of places looking at these split the difference ideas, these hybrid models where you're maybe in school for a couple of days, home for the other days, to try to reduce the number of kids in the building at any given time. But given the surge in cases, we're even seeing people pull back from that and maybe saying, okay, let's just start all remote.
Oh, I mean, listen, I'm with you. I don't. Everybody speaks for themselves. The amount of retention that I saw with my younger kids with online learning was minimal. They'd be better served if they went back. But to that end, is there international models that some have clearly worked better than other in terms of, some students go for a couple of days a week in person, the balance online, vice versa, so that at least, you have the same brick and mortar for a lot of these schools. They only have a limited amount of space. Has one model worked better than others in Europe and Asia?
If we know which model has worked the best. I think what we see in a lot of these is places are attempts to sort of do physical distancing within the building, mask wearing. Obviously, mask wearing is a good idea, regardless of whether you're in a school or a shopping mall or the grocery store or a doctor's office. I mean, that is going to be the recommendation for schools as well. And of course, that's going to be challenging to keep little kids in masks. Also trying to keep kids spread out. You see in some places, barriers, almost like little carousels that you can see through, set up at kids' desks. In some places, you see the desks spread out. You see a lot of different flavors of the same basic idea, which is trying to keep people not from being right on top of each other, which is, of course, what it would look like on a normal school day.
Limited liability, I know that's one of the issues that's being debated right now, and then trying to increase or extend, the aid packages right now on the Hill. To that end, how's a school supposed to manage that if there's the risk that if somebody's kid gets sick at school, that there may be some liability and they could conceivably be sued? How much is that overhanging some of this conversation?
I think it's always there. I think that's a piece of it. I don't know if it's the biggest piece, but I think it's an element.
And to that end right now, when parents have to decide, I think we make this mistake that they'll be, okay, either the school makes a decision, says this is what we're going to do, and then the students follow. Are people taking educated guesses how many children at the end their parents are going to feel comfortable to send them back? And how does that work as it relates with the teachers and figuring out how many kids you put into a schoolroom, and God forbid somebody gets sick, and then what do you then shut down or quarantine which body of children that may or may not have been there? How much of this, coming back to the original question, is still a moving target, and that the virus will decide for itself how this thing plays out?
Well, I think there's no question that last point is true. I think one of the strategies that is getting a lot of conversation about is trying to keep kids in cohorts, which means you've got 10 kids in a class together, keep those 10 kids together and try not to let them interact with anybody else. So that, for instance, they have lunch in the classroom together. They stay in the class. They don't move through the hallways with other kids. And the idea is that, let's say one of them gets sick, then those 10 kids get sent home and quarantined to see if they develop symptoms as well. You don't have to shut down the whole school. So that is one of the ideas, to try to limit that exposure.
Obviously, real challenges ahead here, and I don't think there's one simple answer, but I appreciate the time, Laura. Thank you so much.
Sure. Thanks for having me.
All right, everyone, stay with us. RFL will be right back.